Have you ever heard your grandparents express the witty saying that they're getting too old for this? Hi, I'm Sana, and along with my group Wafa, Islam and Bilal, we're going to give you a little presentation on hip prosthesis. Osteoarthritis is one of the most commonly diagnosed diseases in Australia with more than 500,000 cases per year. It is a progressive disease where the cartilage in the body's synovial joints being the hip, spine, hands and knees start to wear away, resulting in severe pain and joint stiffness. Osteoarthritis occurs when the cartilage and synovial fluid between our joints, which lubricates the ends of our bones for easy movement, starts to disappear. The treatment for this disease is simply painkillers and self-care. However, scientists and researchers have created a better treatment method for osteoarthritis known as hip arthroplasty. First invented by John Charnley, this surgery procedure basically removes the entire hip and replaces it with a man-made object and thus enhances the quality of life. Hip arthroplasty consists of two implanted parts, the pelvis implant, which is an acetabulum socket, and a femur implant. The process of installing the pelvis first begins with the removal of damaged cartilage and bones from the hip socket, of course under anesthesia. The bone is then reshaped to fit the artificial joint. These joints are usually made from plastic, ceramics, or metal depending on the brand. First off, we need the head, known as the socket, which would eventually hold the other end, known as the board, to produce the artificial hip. This is glued into the pelvis with cement and screws. Well, now it's time for the ball. The upper end of the femur is removed and is hollowed out to allow the rod to be placed in it. A long narrow implant known as the stem is then inserted into the femur. The ball is placed into the socket with its joints then tested to ensure mobility. An X-ray is then taken before closing the patient back up to ensure everything is in its correct place, and the patient is monitored for at least 6 weeks after surgery. A cemented joint prosthesis uses fast-drying cement to help affix to the bone. This prosthesis has its advantages, which include the ability to dry quickly within 10 minutes, as well as being able to add antibiotics to remove harmful bacteria that may cause post-surgery complications. However, it does have its downsides, with the cement breaking down and the patient needing more surgery. The cement may also not be biocompatible, and the patient's body may not accept the foreign device, which can cause inflammation and injury. Although it's rare, it has the possibility to break down small enough to enter the bloodstream and lung, which can be life-threatening. The second kind is cementless prosthesis, where the surgery technique uses a porous material between the bone and the implant that encourages bone growth. There are certain advantages of cementless prosthesis. The porous material is full of nutrients that ensures that the bone grows out to secure the arthroplasty. Studies find that it could last for up to 20 years. The problem with this is that it can only be used in patients with healthy bones that still have the ability to grow, and it requires a 6-week recovery time. Another disadvantage is that cementless prosthesis is much more expensive than cement prosthesis. Extra features of this surgical technique can be used to improve hip anatomy and create an easier connection and compatibility with arthroplasty. Having robotic assistance could also help reduce unnecessary complications and infections for better clinical outcomes. It is clear that future surgical innovation will have to demonstrate cost reductions as well as improvement in care. The orthopedic community can take pride in the substantial improvements that have been made in hip arthroplasty for treating degenerative conditions of the hip. With more than 1 million hip replacements done each year, it is easy to see the impact of this simple medical device.